welcome back to Let's Talk About Mental Health. I'm Nels Kloster. I'm a psychiatrist working in Southern Vermont.
And my name is Robert Stack. I'm a licensed alcohol and drug counselor. And good evening. Tonight, last week we finished up with a question about depression, and we had talked about this before between ourselves, that we would like to devote a whole show talking a little bit about depression, things to look for, symptoms, signs of it, maybe some ideas about possible treatments, some complications maybe around alcohol and drugs. So I think the one thing that, before the show we were talking about this, that we want to make this not like a lecture or anything, but just to be helpful. And maybe if you suffer from depression or had depression, if you have any questions, you can call. We're going to put some numbers up there, hotlines, emergency numbers for people to call. You should write them down if you think you might need them with somebody you love or know. And also, if you have any questions for us, you can email them, and we will get back to you, or we'll answer them next week. So I guess that's the purpose of tonight, right?
Yeah, right.
Okay.
Because books are written about this. There's a half hour isn't enough of a time to really teach too much about depression. So what we're hoping to do, right, is rather than sort of bore people with statistics and that sort of information, I think what most people want to know is, how do I recognize it? What can I do about it? How can I help?
Right.
Right.
Yep.
Because this is something that, like any sort of mental illness, whether it's the addictions or depression or bipolar disorder, depression is very, very common. And so it strikes so many people that it's not unlikely that we'll each find it in our family at some point in time.
Right, and you can have depression once in your life and suffer from it and get over it and never get it again, or you could suffer from depression off and on for a very long time, and you can just have a period of time in your life when you're depressed. I usually, when I talk about this, when I used to talk with the patients about it, I would start off with the two physical symptoms, and those are sort of easy to sort of really are subjective, if you will, in some ways. And the first one would be weight loss and weight gain, and again, it's a percentage of weight. It's not so much, it's how much weight you've gained or lost in a certain amount of time, and it's sort of worrisome in that you've rapidly gained a lot of weight, or you have stopped eating and lost a lot of weight rapidly. And the other physical symptom that you'll hear people talk about is sleep. Disturbed sleep, unable to fall asleep, or waking up in the middle of the night having a hard time going back to sleep. And again, that's over a period of time. Quite frankly.
And even in waking up early in the morning, that's sort of what a lot of us experience, say, waking up at 4 o'clock in the morning. I'm anxious, I can't get back to sleep, and you realize you're not getting back to sleep whatsoever.
Right. Yeah. I remember one time I was showing a film on depression, and they showed a man looking at the clock where the minutes tick over.
Oh, yeah, on those old
clocks.
That's
right, it was an old one. Yeah. But about half the room identified with it, laying in bed, looking at it, and just recognizing, the minute goes by, 15 minutes, an hour goes by.
Yeah, wishing I could sleep, trying to will myself to sleep, and it's just not happening.
That's right. And you recognize that over a period of time, not getting enough sleep. I heard this the other day. They were talking about how that can lead to other problems. Lack of sleep can lead to other issues and stuff. But it's definitely one of the things that you would see with people who are depressed. And it's interesting, at the same time, last week the lady asked this question. She said they're always in bed. And you'll hear that about people who are depressed who don't want to get out of bed, who are in bed. But that doesn't mean they're sleeping.
You might say, they might say, look, I'm sleeping all the time. But then if you really sort of dig down and ask about the quality of sleep, they're not. They're lying in bed wishing that they were sleeping, but they really have very poor quality sleep with them. And sleep, very important symptom. Probably one of the ones that, like you said, one of the ones that jumps out. But as we referred to in the past, there's this, this manual called the Diagnostic and Statistical Manual, and they list 9 separate symptoms around depression. And if you look at some of the questionnaires that also have to do with depression, one that's known as the Beck Depression Inventory, there's 21 questions.
Yeah.
So there's so many facets that you can find that actually play a role in depression. But of course, the main one is sort of saying I'm sad. You know, my mood is down, my mood is no good, I'm withdrawing from things that I used to like to do.
There's a difference between just being a little sad once in a while and sad when you're depressed. What would you look for differently?
Well, you know, one of the things we look at is how long it lasts.
There you go.
You know, understandably that, you know, I have a bad day, I have a bad week or a bad weekend, I'm overstressed, and that, you know, might be considered to be you know, a normal reaction to just having a hard time. You know, those things we go through. Work's not that great, relationships are struggling, and those kind of things have us down. It's when it persists over a long period of time, and 2 weeks is considered, again, it might seem kind of funny to be very specific, but it's got to be for 2 weeks to have this happen. But that's supposed to be the cutoff for when we start to call it depression. And to have a number of symptoms together, so in addition to sadness, you know, having the difficulty with sleep, or not being motivated, or having poor energy, I can't concentrate, I can't make up my mind about things, and again, I'm not eating, I can't make decisions, and the sense of either just being kind of like blah, like just sort of a lump, I can't move, I can't get going, versus I'm just so revved up, I can't sit still.
Right.
I'm a very anxious type of person.
I was going to say that. I mean, it's almost like I'm going to contradict myself a couple times here, because one of the other things that you see is that people are restless.
Right.
They're sort of agitated. So a lot of time when people think they're depressed, they're like looking at the floor, not moving. And that's not necessarily true.
Yeah.
As a matter of fact, you might see somebody who turns the TV on, then turns the TV off, goes into the kitchen, then goes here, goes there.
They're restless. They can't sit still.
They can't sit still. And one thing, and then this is where some folks who have depression immediately identify, they start a lot of things but never finish.
Yeah.
And they sort of get involved with things. They want to do something, or they pick something up, but it doesn't work. You know, they don't do it. They don't complete it. And probably most important, they don't have a sense of doing anything of value.
Right.
I mean, I think that's one of the other things that you run into with depressed folks. They begin to feel, and you know this, I mean, it's like the one, not one word, but one of them that you look for is that sense of being worthless.
Right.
Not having any meaning in your life. You know, and the lady last week was someone who had lost their job.
Right.
And we talked about, for sometimes with men, what they do is who they are. And when they don't do that anymore, and it's not just men either, it's true for women also, but it's almost as the way that you identify yourself. When you lose that, you sometimes lose a little bit of like, well, what's my purpose? What's the thing I have to look for?
Yeah, yeah. And again, we want to avoid the idea of being too sort of academic about this thing, but it sort of ties in the idea of, you know, where does it come from? I think like we've talked about with other problems that people struggle with in mental health, that there's a, you know, genetic and an environmental component to it. Or again, you know, in sort of plain English, there's, you know, nature and nurture that play a role in this. And when things happen to us that are devastating, you know, of course we're going to have a reaction of being sad. We're going to struggle with the possibility of being depressed. And you know, one of the sort of schools of therapy called interpersonal psychotherapy really pays a lot of attention to this idea of transitions, roles that we play, and that finds that when these things take a large change, whether it's say divorcing, becoming widowed, losing a job, just like entering retirement, or say going off to college, that these are the sort of circumstances that carry a lot of stress with them, and can make one prone to experiencing, you know, serious level of depression.
Right. One other symptom that, and this is one that, again, I've learned so much from my patients over the years. I mean, quite literally. I mean, really. But one time I was talking about the loss of pleasure in normal activities, and it's something called anhedonia. And it's this idea, and I used this example of somebody that I had interviewed. They'd like to go fishing, and they sort of had gotten the whole thing together. You know, they got the boat and the bait and everything, and they got out in the water. And when they got there, they realized that it was just...
It's no fun.
It was no fun. It was boring for them, and they went back home. And what you'll hear sometimes, people who are living with people who are depressed, they want to be encouraging. And they'll say, well, why don't you do this? Or why don't we go here? Or why don't we go there? And they'll even go along sometimes. But if you're truly depressed, there's a good chance you won't enjoy it. Yeah. Which is really, it sort of makes you worried. And the one that, when I was working with men sometimes, I would mention that sometimes they would have loss of pleasure in sexual activities. I mean, they would just, I mean, that's so scary. and you know, nobody likes to talk about it. They don't want to mention it. And one of the issues that I worked with was people who do alcohol and drugs. It's hard to determine sometimes what you're looking at. Are you looking at somebody who is depression is caused by their alcoholism? I mean, that does happen in some cases, but not that often. And I run into people who sometimes will say, well, alcohol's a depressant and that's why I'm depressed. Well, that's not necessarily true. When they say alcohol's a depressant, they just mean that it's shutting down your systems, right? I mean, it's sedating you.
Right, right.
Right? Your blood pressure, your pulse. Go ahead.
Yeah, no, because you have sort of, two, really oversimplifying, sort of two sets of neurons in the brain. And, one set is sort of turning things up, excitatory, sort of get things going, stay awake, run, fear, fight or flight or freezing. And then the other set is this sort of inhibitory or, depressing sort of signalings that go on. But there's been research back and forth for years. There's the idea of, for example, alcohol causes depression. No, depression causes the alcoholism. And I think that, and again, you have to be careful because in medicine we're always sort of changing our ideas with new research. But it seems to be now the leading thought is that something, addiction, alcoholism, actually seems to cause depressions as opposed to depression being something that causes alcoholism.
Right.
Again, I mean, stay posted because it changes over time. And every time they come up with something like, hey, we've got it, this causes that, that's always kind of exciting. But I think it's important, nonetheless, that there are things going on that should be looked out for.
That's right.
Right? I mean, if you're going to treat depression as somebody's drinking all the time, it's a battle because the treatment trying to bring them up and then the alcohol bringing them down. Or there are certain medical conditions that should be looked at as well. I mean, people who've had heart attacks, they struggle with depression. People with thyroid difficulties and a whole host of medical digestive issues as well. Irritable bowel syndrome. So it can be a lot of pieces that are sort of leading to that really should be looked at as well.
And I think in some ways, and I don't know if this is how accurate this would be, but in some ways the depression can be hidden by other problems or other behaviors. And for instance, there was a study done in New York City where a guy studied a group of patients that were admitted in this major New York City Metropolitan Hospital for opiate addiction. And he did a battery test of, a screening, and he found a majority, over 50% of all of them met the criteria for depression in their lifetime.
Right.
Now, the test might have been right or wrong, but nonetheless, his point was maybe that's why they came in the hospital. Maybe it's not just the opiate addiction. Maybe what the problem is that really they're suffering from depression. And yet when you look at an opiate addict, you tend just to see the symptoms. You just look at the opiate. Now, thank goodness we've gotten better at this. But I think the same thing is true for some alcoholics. I mean, not to give them an alibi or anything, but I do believe that there are some alcoholics who have a co-occurring disease, and some of them, quite frankly, in my interviews with them, I think some of them were depressed even as adolescents. Right. And it was untreated, it was undiagnosed, and in some ways I think they've had it all their lives, off and on. And now the alcoholism is first and foremost, and it's what everybody sees. But I've really been amazed over the years when I've talked with patients who got the proper medicine, got involved with recovery, but went on antidepressants. I mean, they were really successful. I wanted to mention that.
Yeah, and I think we want to be careful, too, as we're talking about this, that we don't tend to oversimplify things, that depression is not this sort of single thing all by itself. And that because somebody else drinks, that it's not helpful to say, well, if you would just stop drinking, you wouldn't be depressed. Right. So I think that makes it a little it takes away the empathy that we might have towards people who are struggling with depression. And things are so complex because in psychiatry we've noticed that people tend not to have one disorder, one problem. Especially around depression, anxiety disorders are very common with that. I think, like we were talking before the show about, PTSD and what we have seen with depression, with veterans returning back from the war, as well as having the PTSD and the high rates of suicide there. So there is this tremendous crossover between the addictions and physical illnesses and other psychiatric illnesses as well. Right. The depression doesn't always stand by itself.
And I think one of the clues that family members can look for is that all other things being equal, whether it's their alcohol pattern or use of everything else, if you say to somebody, if you notice somebody and you say, you know, you just don't seem to be yourself anymore.
Right.
And I miss the old you. Now, sometimes that's drinking, sometimes that's alcohol, sometimes that's drug addiction and everything. But sometimes that's a clue for depression. You'll hear that more and more. You'll hear people say, I just want the old you back. And they're really identifying that there's something different about you. There's something that is not there. And a lot of the people who are depressed, now I can't say this on any kind of scientific basis other than my own life experiences, but a lot of times if you ask a depressed person what's wrong, they'll sometimes say, I don't know. I don't know. Yeah. And that almost is like a clue, like, well, I don't know what's wrong. Mm-hmm. And some people will actually say, and I don't want to exaggerate this, but occasionally you'll run into people who will say nothing. And yet as a family member, you know that there's something wrong. Yeah. And quite frankly, I don't think that the loved one is lying to you. Depression is really hard to describe. Yeah. I mean, you know, like what physically is wrong? You know.
And guys too, right? I mean, as in touch as most of us guys are with our emotions, it often takes somebody other than us, a family member, our partners, you know, good friends. You know, you're not the same. You don't seem like you have been. You know, not as much fun. Not you don't call me anymore. That kind of thing. What's wrong?
Right.
And often I know, like in early recovery from other illnesses too, where it's saying, you know, when people ask that question, what's wrong? And you say nothing, and you say it very quickly. That's a sign to kind of start paying attention because something is wrong and something's going on. And the longer you ignore something like this, the worse it can get.
Right. I mentioned this film I showed to patients, and there's a scene in there where the man breaks down at the table, at the breakfast table, and he starts to cry and says, I don't know what's wrong with me. I really don't know. And he's frightened. And if you're depressed, you're frightened. Yeah. I mean, you know,
right.
I don't
it's
mean
going to
that
always
in a mean
be
way,
like
but
this.
you really are. And he started crying. And of course his wife was there and she nurtured him and they went for therapy. And I asked my patients, I said, well, how many of you had that moment of crying except nobody was there? And the majority of them raised their hands. Yeah. I mean, I think that's when it gets really scary for some people. And the worrisome thing is that when you're depressed, you feel all alone. You feel that it's starting to get hopeless and you feel sort of trapped. And you know, I think if you think you know somebody who's depressed or you're worried about them, and the number one thing you can do is talk to them.
Right.
And tell them that you've noticed something. And also, I don't know if this is true, but I believe it to be true, that people who are depressed don't want to be depressed. Yeah. You know what I mean? And I really think that if you tell them, let's go see somebody, or you should go see somebody, they're more receptive than they might normally be. Because a lot of people, when they get toward the end there, they sort of get desperate. Like, I don't know what to do. I don't know where to go. I don't know what to do. And you'd be surprised. Sometimes you just say to somebody, well, why don't you go see somebody? Or why don't we go call somebody?
Yeah,
go
because
ahead.
we're social animals. You know,
Yeah, right.
we are meant to run in a pack. We rely on our families for our protection. I mean, you know, historically it took families for protection and for our personal and you know, social needs. And we're meant to be with other people. So, you know, a very strong piece of treating depression is that social connection. A very strong piece of being depressed is you pull away. You know, you don't want to be with your friends, you don't want to be with your family, you're not interacting with them anymore. And so it sounds like, you know, we're telling people to do what they can't do and don't want to do, you know, sort of, you know, contrary, but pulling the person along or pushing oneself to do something that's enjoyable is really a very important piece of this, and hopefully, you know, over time, actually, you know, helps to bring that person out of depression. But
Right.
letting the person who's depressed struggle with this on their own, well, I mean, it's an approach, but some of this, what they call naturalistic studies, the studies that sort of follow people who are depressed but don't get any treatment for depression, that depression can last for 1 to 2 years without treatment. So it really, that's a significant period of time, and you start to kind of get tunnel vision and not look at your other options. You think this is it, nothing else is going to ever happen. And you know, the ultimate thing we're concerned about with that tunnel vision is that it narrows down the point of, you know, I could kill myself, suicide. you know, maybe that's what I'll do. Oh yeah, that's the answer, because all of a sudden your thinking is narrowed down to the point where that's all you see as your chance to not suffer like this anymore.
Two comments, if I may. I mean, one of the reasons we decided to do this show was to sort of maybe be able to normalize or at least destigmatize mental illness and allow people to talk about it. And I think that, you know, occasionally I'll run into people who know they're depressed. They know that their thoughts are negative. They know they're having suicidal thoughts. They know there's not much fun in their life. And yet they're afraid to tell somebody because they're afraid they're going to say they're mentally ill. It is almost as if that will become official. It's not like they don't know the symptoms, and they know that they are. It's just like if I go see somebody, it's official. I mean, I think that's I mean, I would hope that part of this, doing this, is to sort of say, no, it happens to people. Yeah. It's not your fault. Yeah. You know what I mean?
And what a shame. So it's official. Why should why should that deter people from getting help they need? You know, again, didn't want to bore people with statistics, and maybe this helps kind of, I mean, to normalize what's going on here. I mean, depression has been around forever. People look at, looking for evolutionary theories about why has depression always been there? Why does it always persist? So it's natural, it's normal. I think we want to say that. And again, to be careful, not to dive into statistics, but 6% of people within a 12-month period, 6% of people have experienced depression. And if you look across everybody's lifetime, then 15% of people have had an episode of depression at some point. And if you've had one episode, you have a 50% likelihood of having a second episode. If you've had a second one, then there's a 70% chance of the next one, then 80%. So each episode then increases the odds of having another one. So this is a common condition, something that happens to 15% of people in a lifetime. That's very common. So it's a shame there'd be some stigma around this, because it's the same thing as almost having high blood pressure or other sorts of medical problems with the prevalence of depression.
And I want to repeat what you said earlier, I mean, because it's a good point, and you helped explain to me before the show, and that is the combination of anxiety with depression, that having both anxiety and depression, and feeling that kind of intensity, if you will, and how scary that is. Now, we've been talking about people who are sort of not in treatment, and I guess I want to take a moment to talk a little bit about people who have lost faith in medications. And again, I go back to this because of my life experiences, but I know I've worked with alcoholics and addicts who said, oh, I took that medicine, it doesn't work. And I usually ask them, well, were you drinking at the time?
Right.
I mean, what was your lifestyle like? And, we need to take another look at that. You want to share a little bit about medication?
Oh, sure. And absolutely. But I also sort of put a plug for things that are not necessarily medications.
Right.
It can be good medication, should we say? Exercising, changing your routines, having a social group, love, all these sorts of things. They're very good medication. But if we're going to talk about the actual pills, then you're right that all the trials in the past have been these very artificial sort of trials, looking at let's put a person on some medication, they'll be on it for 2 months and see how many people get better. But now started looking at sort of doing research that mimics sort of real life. And so they chose this medication, Celexa, and gave, or I think it was Zoloft, but gave everybody entering the study, 1 or 2 medications, and they found that only 30% of people get better on the first medication that they take. So that means you show up for treatment, you give it an antidepressant, 1 in 3 people are actually going to start to feel better from their depression. And then when they got to a second antidepressant, you started to see improvement in 50% of people. And so it really is an argument, given sort of the impact of depression and how long it can last if it's not treated, that you need to keep at it. That one sort of failure of a medication doesn't mean that medication is not the answer for you. Right. But then, too, medication is not the only answer either. So a lot of people don't want to take a pill.
That's right, and I've talked about this on the show before. I mean, I'm a big fan of cognitive behavioral therapy, and I believe in talk therapy, and I think it can make a difference, and it can change your worldview, and it can be helpful with depression. It's just that my experience in working with it was that sometimes you had to medicate people, just to get them well enough to get therapy.
Right.
I mean, really, quite frankly, I mean, in some ways. So, I mean, I guess that's why I thought that right away. Obviously, there's other ways in diet and exercise and lots of things, but sometimes people have gotten to that point where medication is really, if it's the right meds, if, you know, can be very helpful. Right. And turn a corner.
Yeah, and I mean, what I was taught was that you sort of look at various levels of depression. So if you look at some of these questionnaires, like for example, the Beck Depression Inventory, it has scores that then give you sort of a level of depression, whether it's a mild depression or whether it's moderate or whether it's severe. And for something that's a mild level of depression, well, it could be, you know, more associated with kind of lifestyle, something that would respond to, say, you know, joining a group, getting some exercise, stopping doing those stressful things. And then as the level of depression picks up from there, as it gets to a more moderate level, then the idea is either medications or talk therapy, but let's do something that's a professional intervention. Let's just pick one that seems most palatable to you. What's the thing that you would prefer? Would you like to take a medication, see how that works? Would you want to go talk to somebody about what's going on? And then if it gets to the point of being to the severe level of depression, you know, this is where people are really not getting out of bed, they're not going to work, they're starting to have those thoughts of suicide. We should get aggressive. These are people who should go to treatment, go to counseling, I mean therapy, as well as take a medication, because this is a point now where you don't want to underdo it. Right.
And I again, you know, I remember one time I was working with a doctor, and I mentioned that a patient said, I wouldn't kill myself because of my children.
Right.
And I thought, boy, that's a very positive statement, and I want to support that. And I mentioned that to the doctor, and the doctor said, well, that's a great statement, and I'm glad you're telling me that. But sometimes you have to be careful, because people who are depressed can sometimes flip that around.
Right. It would be good for my kids. My kids would
be better off without me.
Yeah.
And by that time, because they're feeling so worthless. And I must say that there is a connection between, if you have parents or grandparents that committed suicide, that you're at higher risk for suicide.
Right.
I mean, that
it seems to lower the bar.
Isn't that true? I mean,
yeah, absolutely. That's statistically true. We think maybe it lowers the bar. That it seems like such a awful thing to do to the survivors, to kill yourself. But there's the idea that if somebody else in your family has already done that, it becomes an option. You can almost understand it better. I mean, you can come to kind of empathize with suicide or see it as why it was a good option for somebody else. I think that puts you at risk too for considering it yourself, and so that's why we see that statistically.
And I also wonder too, because there's some evidence that it's genetic, and you're at risk genetically, and I wonder sometimes if you just are inheriting that severity of depression. I don't know if there's any proof of that or not. I mean, you know what I mean? Like it could be that it's there. I just want to say that if they're in your family, then you're at risk for it, and you need to sort of be aware of that and not be afraid of it. I mean, again, like to find someone to talk to. I mean, go out and reach to somebody. I mean, the worst thing I think that can happen with depression, and I may be wrong, and you've heard me say this a few times, but is that sense that it's not going to get better, that things are getting worse. And I don't see a way out.
Yeah.
And like you said earlier, and I want to assure people that people do get better, and there are people that help you, and there is medicine that help you. So please, please don't feel like I'm trapped and I can't get away.
Yeah. And families can be supportive, whether it might not seem like it. Talking is important. That people still want to be talked to. Again, try to encourage them for other activities, to sort of pull them out. Encourage the depressed person to get into treatment. Do what you can around the home. Try to sort of decrease some of the stressors, some of the demands around the house. Not to encourage them to become a sort of an invalid, but to sort of pull them along, keep them out of it, keep them active. Try to find things they can actually do to be able to improve the depression.
Last year when I did the show on depression, I think I titled it, Say Something and Save a Life. Really, quite frankly, it's if you know someone who's depressed, or if you're depressed yourself, please get help. Call these numbers, reach out.
Right, because in the worst case, we're worried about suicide, and there's some numbers both locally and nationally that people can reach out to.
Thank you very much, and I hope this has been helpful.
Yeah. Take care.